Definition of suicide. Whether euthanasia or assisted suicide, the result of death is achieved by the assistance of outsiders or external forces, while suicide is achieved by oneself. Assisted suicide will face legal punishment, but suicide is not constituted in the current law criminal. However, this extreme social behavior of individuals trying to cause death has aroused the concern and research of scholars in the humanities and social sciences, trying to explore the possible meaning and factors of human suicide behavior. The sociologist E. Durkheim defines suicide as an individual's positive or negative action, knowing that the result of such action will directly or indirectly lead to his own death. The psychologist Schneidman, 1985, defines suicide as a self-destructive act of consciousness in which an attempt to be understood as a recognition of suicide by a person in need as the best way to solve his or her problem. According to the definition of the World Health Organization, WHO, there are three terms related to suicide. Suicide, 1. Suicidal act. Suicidal act self-harm behavior with clear motives and varying degrees of lethality. 2. Suicide, suicide that causes death. 3. Suicidal attempt, suicidal behavior that does not result in death. Cause of suicide. Why people commit suicide can be discussed from four aspects. 1. Psychological level. According to previous research by scholars, suicide tendency is due to the decline of normal psychological mechanism, that is, the decline of mental ability or the deviation of the personality of the suicide. Psychologist Freud believed that when individuals experience great psychological pressure, when the inner conflict is confused, it is easy to lead to suicide. 2. Physiological level. Although suicidal behavior sometimes occurs in the same family, we cannot assume that suicide is genetic inheritance, because family environment is also a possible factor. When it comes to adolescent suicidal behavior, we cannot ignore the physiological changes of adolescence. Another factor in suicidal behavior is disease. 3. Social aspects. There are many sociologists such as Durkheim and Schmidt who oppose the congenital theory of suicide. They generally believe that the urban area has a fierce population movement, excessive social changes, and a high suicide rate due to poor adaptation. 4. Spiritual aspect. As the haze of death approaches, the patient will begin to think and search for the meaning and value of his tragic life, often feeling powerless and helpless because he cannot find the meaning of life, and even has a spiritual crisis of suicide, so he is on the verge of death. Patients often seek spiritual needs such as human love, hope/strength, meaning/purpose in life, and the trust and understanding of others.